So first of all, I'm delighted to welcome Dr. Louise Scott, who's Head of Local Governance and Reform Analytical Unit in the Scottish Government, who will be talking about evaluation in government under the SNP administration.
Thank you very much, and good morning everybody. I'm delighted to be here to talk to you about the role of evaluation in government, and particularly to take you through a potted history really of research in government, evaluation in government, the role of evidence in government over the past wee while, and to have a think about where things might be leading in the future, and to give you some of my thoughts on what I think the future might hold for analysts both within government and out with government. So these are some of the key milestones that I think we need to acknowledge recently. And going back to 1997 and the election of a UK government, a Labour-led administration that really put evidence at the heart of policy making. And this led us to a pre-2007 position where we had policy making that was very much focused on cost. It was very much about central government being in a command and control position, about delivering universal services in quite a hierarchical fashion. And so we were definitely interested in what works and why, but what we were interested in was more about that process of making sure that the costs were kept to a minimum, that we were delivering the right services to the right people, that we had the processes right. And from that perspective then, evaluation, the purpose of evaluation was really to manage the means by which services were delivered. It was to get the right inputs and processes for more effective services. And actually, I think it's fair to say that there was quite a weak accountability for outcomes. And although we talked about outcomes evaluation, in reality, outcomes evaluation evaluates against objectives. And given that we weren't talking in outcomes language then, I think we were talking much more about outputs and what policies were achieving in terms of outputs. But the way central government worked at that time, I would say, was in taking the lead in performance and the what works agenda in order to complete the cycle back, to plan resources, to manage people budgets and performance, and then deliver services across organisations, structured by profession or by sector. Some people might also refer to this as the tartanisation period because it was really a heyday for evaluation and evidence in government. It was a time when we were interested in what works from a Scottish perspective as well. And so I think that takes us up to 2007, but as you know, in 2007 we saw the election of a minority government in Scotland with a new SNP administration, which was different from down south. And at this time, we felt that the role of evidence would continue to be quite central to policy making, not least because it was a minority government. And so the SNP administration needed to know what works and what doesn't work, to understand what the evidence was telling them so that they could either bring the majority round to their way of thinking or at least be prepared for what the arguments might be, the counter-arguments to their agenda. But I'm going to take you through the other issues that arose, the Concordat, the outcomes approach, and also recession and a very tight economic climate that we've been experiencing since then. And so what's happened to evidence, evaluation, and analysis since 2007. I think what we've seen is really turning that previous slide on its head. The move to outcomes working and outcomes-driven policy agenda really puts evaluation at the start of that process because the first task is to evaluate need. It's about putting people at the centre of service delivery. What is it that the people need? What is it that communities need? What are the problems that need to be addressed? And at this stage, it's really about bringing people together to have conversations together, to plan together, so that you can address a particularly complex issue in communion. And so the role of evaluation then is to align goals primarily and to get multiple approaches to work in harmony for better outcomes and to work in partnership. The role of central government in particular is then to influence and support these programmes and still to commission services, but it's in conjunction and in collaboration with the people who understand it, in it very much along the lines of what we call co-production. Okay, so I'll run through these in a little bit more detail. First of all, the Concordat. What impact did that have on the way we do evaluation in government? Well, pretty much overnight, the signing of the Concordat ushered in a new relationship between central and local government initially, and then the broader CPP shortly thereafter. And it meant that relationships and responsibilities changed dramatically. It was much more about a partnership way of working. It was about identifying solutions and allowing local government the freedom and responsibility to address issues that really affected themselves. And so where central government in the past might have taken a role in, for example, initiating pilots or evaluating case studies with the intention of learning from the evidence of these small, isolated examples, building a generic evidence base and then rolling out nationally, really this changed quite considerably. And instead, there was no longer a sense that there would be a national rollout, because it was really up to the local level to decide what was best for them, and national rollout wasn't always the best thing. And so this has led to a single or multi-site evaluations for learning. The role of government then has been to facilitate this learning or to part fund it, but it's certainly not to lead it. Okay? I'll give you an example here from the... there are lots of examples that I could use with frameworks being set up where local initiatives need to be developed. But a good example, I think, is the healthy weight communities. Here I refer to it as healthy living. It's also the Equally Well example that I think Erica will be talking a little bit more about afterwards. But healthy living was really... it was a group of 8 local authorities, local authority level governance arrangements, I should say. I don't mean the local authority itself, but the community planning partnership, if you like. 8 areas that agreed to be pilots for the Healthy Eating, Active Living Action Plan. And they came together to identify what the problem was, particularly around obesity. So they brought together people from the public sector, private sector, third sector, central government, local government, people who had an interest in addressing this issue. So first of all, aligning the goals. What is it that we need to tackle? Identifying locally for themselves what the specific issues were for them, what skills they had locally, what resources they could use, and tackling this problem from a very local perspective. The role of central government was really to facilitate that learning. And so an action learning set was established with representatives from each of these communities and brought together by a facilitator to share experiences, share the process of how things were going. It was an evaluation, but it was a way of learning from each other in order to improve what was happening on the ground as the process moved along. They've also set up a Healthy Living website where they could post new posts, talk about issues as a community of practice, put online some of the evidence that may have been collected locally. And so it was a very collaborative approach to a very real issue driven by the local area, but very much learning from each other and with each other in order to improve this process as it went forwards. The evaluation publication is online and can be accessed. But I think this is a good example of different ways of working and the kinds of evidence that became more possible and more essential in this new way of working. Okay, the next agenda was moving to an outcomes approach. And pretty much overnight, when SNP came into office, they set out an agenda for outcomes, working in an outcomes way. So we moved from this input-output area and moved very much to trying to look at bigger picture outcomes, which from evaluation purposes are much more long term. You know, how do you get evidence on something that's going to take years, possibly generations to achieve? What role does evidence play within that? Well, alongside that, Scottish Government developed the National Performance Framework in order to try to monitor that. But the job has really been getting a handle on what evidence you need to make that work. Okay? And that really has necessitated an interest in logic modelling and contribution analysis, which still uses evidence. Evidence is quite central to that, but it gives you a long-term picture of what you want to achieve, allows you to break that down into short and medium-term outcomes, and underneath that is pinned the evidence on, or an evidence framework on what you would expect to see if you wanted to achieve that outcome, both in the short term and the medium term. I won't say too much about logic modelling, because again, I think Stephen's going to cover more of this this afternoon. But nonetheless, analysts in government needed to become quite quickly experts in logic modelling, which was quite different from the work that they've been doing before. In terms of programme planning, we were looking at more of the long-term picture and trying to plan programmes of work so that we understood what we needed to demonstrate the short and medium-term evidence needs. So this has required a focus on data, understanding quantitative data to demonstrate whether we are achieving what we need to achieve, but also very much the what works evaluation data. So if you know that you're not reaching your milestones in a particular area, what interventions are going to help you reach that? What do you need to do to achieve that outcome? So this was very much the focus, has been very much the focus for the last few years. And then the tight economic climate. I think it goes without saying that in financially hard times we do need to be creative about what we do. We need to think very carefully about the spend that we're making. And I think we had the assumption that both evidence and evaluation would help to identify priorities in this tight economic climate, to allow us to see the what works, what isn't working, what are the areas that from your budget really could be dropped to give you a better bang for your buck by placing the money elsewhere. What it meant for analysts, again, for the evidence base in government, is that there's been less commissioned work and certainly more creative approaches to understand or to getting the evidence together in order to support policy decisions. And I'll provide an example here of the population surveys. There'll be people here who are familiar with the large-scale population surveys that central government takes responsibility for. And there was certainly no suggestion that we would stop doing these, because to devolve these to 32 local authorities and ask them to provide the costs and the resource to go into making sure that the evidence base is reaching them and providing them with what they need really was not going to work financially. It was much better that we retain this centrally to benefit from economies of scale. But nonetheless, we did need to do things differently and take some very difficult decisions about the frequency with which we run the surveys, the detail of the questions that are asked, the sample size, and so on. And so in all of the population surveys hosted by central government, you'll see that there's been quite a big change over recent years. And always to try to retain the quality, so that when there was a demand and has become an increasing demand for local evidence, that we don't lose that and we haven't lost that from the samples, for example. So that's where we got to and where we've been working towards for the past 4 years. And then in 2011, SNP were re-elected, and this time with a majority government. And more recently, we've seen the publication of 4 strategy papers that are quite key to the future directions of government. I think if you're not familiar with these at the moment, I would say definitely pay attention to them, because this really is the agenda for the next 4 to 5 years. It really sets out a very clear map for where government is going to be working and where its priorities lie. And I want to structure the rest of this conversation around prevention, partnership, people and performance, which are the 4 pillars that are identified in the response to the Christie report. But I think it's fair to say, in terms of the future, that things are not likely to change. We do have an SNP administration back in power, and I think the trends that we've seen over the last 4 to 5 years are going to remain. I do think, though, that they will be bolstered by these pillars, and they give us a really helpful place to hang our future work, but I don't think they're radically different from the work that's been happening already. I think we can take some comfort in knowing as analysts that we're heading in the right direction, but perhaps with a few extra tweaks. Certainly there's going to be a faster pace of reform now that there is a majority government, and this government is very keen to make sure reform happens quite quickly. So I'll take the first of these pillars, which is prevention. And the idea behind this is that the demand for services is only going to increase. We know from population data that the population is ageing. There's a strong demand for services from changes in population structures. Expectations have been rising for services, and we really need to do something about prevention rather than tackling demand. So to ensure services are sustainable, we need to build prevention into design and delivery of services, focus support on early years, and tackle intergenerational inequalities. That's what the response to Christie tells us. We also know that we're going to be operating still within a very tight climate, economic climate. Budgets are going to be cut in real terms by 12.3% up to 2015. So this focus on prevention is absolutely critical if we're going to reduce demand for services. This for me means several things for evidence and the role of evidence. The first is that we need to capture what impact this is having on outcomes. So we need to capture the upstream initiatives and their impacts. There are a number of prevention areas where investment in prevention has been made, and getting a handle on what that means, I think is going to be quite a challenge. If I break that down into something quite meaningful for most of us, if you think about fire and achieving better outcomes for a fire service, if you translate that into now about fire prevention, in the past your target would be to increase the number of fires put out, to reduce the costs of doing that, to reduce the response times, for example, of doing that, to provide a more effective service. Now the emphasis is much more upon preventing those fires from happening in the first place. How do you provide evidence on what that means? What are the outcomes that you're achieving? What's the cost of that? It's going to be very difficult and quite a challenge, I think, for us all to be thinking about in the next few years about how we do that. The other aspect, I think, down at the bottom here is the need to develop fine-grained evidence to tackle root causes of inequality and pockets of disadvantage. What we do know specifically about Scotland is that there is a group of roughly the 20% of the population that we know are in this group of the disadvantaged, and a group that really is where the greatest demand for services is happening. So we need to understand more about that, less about the service quality, because they're actually receiving the same qualities in some aspects. There's been some research done by the Improvement Service on education data to suggest that despite receiving the same education service, the outcomes for these people remain the same. So we need to understand that much better. I think that's a challenge for analysts in the future. The second area is about partnership. And the idea here is to improve outcomes for people, improved outcomes for people and better use of resources can be achieved when local services are planned and delivered through effective place-based partnership and integrated service provision. I think the healthy living example that I provided you earlier on obesity is a good example of how you do this. But I think in terms of evidence, as analysts, I think we need to be, it's going to be much more about co-production in the production and sharing of the evidence base. And by that I mean that a great deal of public money is spent on evidence, and what we need to do is share that resource better get the evidence to where it's needed. It doesn't matter who's providing the evidence, but make sure that we're not duplicating the effort and getting it to the people that need it. I think also the improvement team within health is a good example of this, with evidence providers from right across the spectrum, working together to understand what the evidence needs are. I think there's also a need for very local evidence and data as well. If decisions aren't going to need to be made locally, we need to empower people locally to understand what the evidence means for them. And I'll highlight two examples here. There's the Scottish Neighbourhood Statistics, which I think this audience will be familiar with in terms of understanding what that local level evidence is telling us. But also, again, I'll highlight the work of Evaluation Support Scotland, who work with organisations to provide them with the skills and the capacity in-house to understand what works for them, so that they can do their own improvement at a very local level. And this, I think, is a really helpful model for moving forwards. And I also raise here the role of single outcome agreements, because that's going to be a vital source for making data available to the public at a local level, so again they can take decisions for service delivery for themselves. The third pillar is people, and I think this is probably the least developed at the moment, but just to say that this probably for me revolves around two areas. It's about getting better data on the workforce and better intelligence on the workforce, particularly what that looks like in terms of part-time, full-time, breakdown, and different equalities groups, so that when we are making changes, when there are reforms being made, when people are losing jobs, we understand the impact of that and what demand that's going to have on public services. The second area is around leadership skills for managing change and uncertainty. And I think as analysts, I think we have two functions here. One is to ensure that the evidence on leadership and managing change is brought together. And organisations like, or the network, the Scottish Public Management Network, is a good example of bringing people together, again, from different sectors, to bring the evidence on these issues to bear, so that we can take them back to our workplaces and leaders can do something with that. But the second aspect is that many of us here will be leaders in our own capacities within our own organisations. And so it's important that we as leaders understand managing change and uncertainty, so that we're able to support our staff in moving forwards. And the final pillar is around performance. And this really hinges on two aspects. The aim of this is to ensure public money is spent wisely to achieve better outcomes and improve value for money. So there's certainly nothing new there. We've been doing this for quite some time. And there's also the issue of transparency. In terms of performance, I think what we do need to see is the development of data. We have the National Performance Framework. We've spent a long time and a lot of resource in trying to make this have both a national feel and a local feel. And I think we've moved a long way since 2007. What we need to think about now is what data do we need at those, if you think about that short term and medium term on that trajectory of the logic model, what data do we need to understand whether we are making progress and the extent to which we're making that progress, particularly at a sub-local level. Benchmarking will be critical, and that's certainly raised as part of the agenda within the spending review documents. But in particular, once we have that data, we need to understand what you do with it. First of all, how do you manage that performance and not just monitor the data? So we need the evidence on what works, what interventions are going to help to improve performance, and get that into a place and in a format that's usable for the people who really need to make that reform happen. And so I identify that there is going to be a need in skills development and performance management from performance data. The final point I want to leave you with is about embracing digital technologies and making data accessible to allow people to come up with their own solutions. If solutions lie with people, with individuals, with communities, we need to make sure the evidence and the data gets out there. And Sir Gus O'Donnell came to speak to the civil service a few weeks ago, and he raised a very good example, which I'll leave you with here. It was some data that was released on accident black spots in a particular part of London. And pretty much overnight, at least over the course of the weekend, a local cyclist group picked up that data, translated it into an app, and between themselves by Monday morning had arranged different routes to work that would avoid these accident black spots. A great example of behaviour change that happened really within days of this data becoming available. Had we orchestrated that within government, it would have taken months to achieve that outcome. So a really good example there of making data transparent. So in conclusion then, I think we have had a decade of growth and certainty with evidence and evaluation. And I think our first term, we've seen transitions, trials, tribulations and triumphs in partnership working, outcomes focus and doing more with less. But I actually think the future does look bright for analysts. I see my vision is of a future of our pillars, bolstered by analysts working collaboratively on shared programs to produce evidence that manages performance, facilitates preventative spend, and develops better long-term outcomes that are more affordable. We just need to seize this opportunity, so the future is bright for us.